Computer issues. Thank you everyone for coming. Do we have any announcements that anyone would like to make before we get started? Hearing none. What I'd like to do is ask if we have a volunteer that would like to take notes for meeting minutes. Thank you very much.
I would, except I'm from Arkansas, I don't know how to.
Right.
Do you write in Arkansas? Is that what Arkansas East?
Arkansas East is not in trouble yet.
I thought you were from Louisiana.
No, Louisiana is county of Arkansas. Along with Texas, Oklahoma, Kansas, and Missouri.
Not everybody is.
Where'd you go to school? LSU?
No.
No?
I started off at University of Arkansas, and before I flunked out, I took leave, joined the military, came back, went to a small state school.
Okay. Somewhere I heard you say something about
Oh,
LSU.
I did go to graduate school in Northeast Louisiana State.
Okay.
Well, let's start off by introducing ourselves. We're in a little different time zone than normally. Normally, what, 5:30? Pardon me?
5 o'clock, isn't it?
Or 5:30, yeah. Well, let's start off. Mary, want to introduce yourself?
Sure. My name is Mary Morris. I am the chief coordinator.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization, praying that my computer will work. And I like to hear that sound.
Cecilia Montgomery, I'm on the board for the senior citizens, and I'm also with the auxiliary.
Diane Clay, I'm with the Hospital Auxiliary, I'm just an interested party.
Amy Harcourt with the Rare AmeriCorps program here at the hospital.
Taylor, Head Start.
Beth Hadley, Public Health.
Ken Kastner, Lake County Commissioner and board member of the EOCCO.
Shane Morgan, Social Services, Lakewood Gardens, and Senior Center Board member.
I'm Larry Coulter. I'm the administrative training for Lakewood Gardens.
Mike Newcomb with the Ministerial Association and Food Pantry, stuff like that.
Yeah.
Mindy Bentley, Advantage Dental.
Great. I'm Charlie Tway, for those that don't know, from the hospital. And who's on the phone call with us?
Do we have anyone on the line? Hello? Okay.
And Darwin, since you just got here, you want to introduce yourself?
Yeah, I'm Darwin Johnson, sorry I'm late, drive off to work, so. Run home.
And Jimmy, do you want to introduce yourself?
Jimmy Hall, Lake County Examiner.
Thank you. Thank you. Has everyone had a chance to look at the minutes that the mayor sent out? If you haven't, please take a minute to look at that. If you would like to have someone make a motion to approve the minutes.
I'll make a motion.
Cece made a motion to approve. Do we have a second?
I'll second.
It's been moved and second. All in favor, please signify by saying aye.
Aye.
Any opposed, same sign. Thank you. Minutes are approved.
I'll abstain because I wasn't here, so I don't know what's been, sorry.
Okay.
Yeah.
Mary, do you want to talk about the community health assessment day?
Sure. So, first of all, so I wanted to just do a short review for everybody. Last week, we went over the community health assessment. And this week, I want to do a review of it because Paul is going to be helping us to set some priorities. This data was retrieved with, in collaboration with the Office of Rural Health from various data sources. So it was not with focus groups. It was through Oregon.gov and the American Census. So just to highlight a few of them, our senior population is growing. 54% of our population is above the age of 54. We have seen a slight increase in the Hispanic population. However, talking to some of you, they believe that it might be even higher than that because we might have people that are not documented. so it's something to keep in mind. And then our unemployment rate has improved. However, we're still quite higher than the rest of Oregon. Our poverty rate is at 20.1, which is people living below the poverty line. Another new factor that we brought in is that we are the second worst in the state for food security after Wheeler. And they come to that conclusion by looking at poverty rates and then access to food. So what is the distance between the person living location and then a store. So as you know, it's mainly Safeway and then corner stores here, right? So, and then our mental health ratio is 978 to 1. So we are lacking mental health providers in our county. And then in terms of direct health, our cancer rate is still the highest death rate at 220 per 100,000, which doesn't seem like a lot, but it is a lot higher than the rest of Oregon. And then we have a higher low birth weight rate than the rest of Oregon. And that's gathered over 5 years. So I inquired about getting some more clarity, and actually even if you calculate it by the year, we're still much higher than the rest of Oregon. So we have to kind of look at what's driving that. So that kind of sets the stage for us to hear from Paul and as a group set some priorities.
Great, so if you can try to plug that in, the screen looks like it's up. Hello.
Hello.
How many of you have used Turning Point audience participation tools? Okay, we'll do a little rundown here. You only get one.
Okay.
I don't know. And I think everybody can participate. Jimmy?
Oh, that's dangerous.
No, they don't break. They're worthless to you without the other piece that I have. Yeah, I mean, they really are.
It's not like the name.
And before we go too far, though, while I'm bringing this up, I would like to call on Vinnie from Advantage Dental. One of the things that we wanted to look at from 2013 to 2016 in terms of changes, here's highlighted some, a couple of them are repeated here, but all we had was the 2012 SMILE survey at that time. And if you can enlighten us about, you know, anything that we found through Advantage, the 2012 SMILE survey had a big region of Eastern Oregon. I believe the northeast part was separate, but basically this county and Harney and Grant and a couple of others that were part of it had caries or cavity rates for the kids that they actually went into schools and saw higher than the rest of the state as a whole. And that was our only baseline data on oral health. And you go, well, why is that? Well, because oral health isn't a reportable disease. You go to the dentist, they don't have to send it to the state like they do if you went in and you had a sexually transmitted infection or your cause of death or a birth is a record that must be reported to the state. So anything you can enlighten us on, especially given the work that's happened here in Lake, would be very helpful.
So last year, it's going to get better with the data. We'll know more once we get a couple solid years under our belt. Last year, we were able to do one screening and fluoride event. That was last April, and we right about a year ago. And then this last fall, we did screenings and fluoride for the kids. We did K through mainly 6th grade. There's kind of some miscommunication. We wanted to do K through 8, but we did K through 6. Here coming up, we're actually coming back to do a second second application of fluoride for kids that have consent. We're going to be doing that May 25th. Along with that, we're also going to reach out to homeschool kids, which we've not done here in the past, so that'll be our first time for them. And we'll be offering screenings, fluoride, and sealants. And sealants we did come back and do here at Adel, Daily. We did a couple kids, Fremont, Union, and ADK. And then We've also reached out and done services for Plush, Paisley, Adel, Trinity County Schools in the Wright County, sorry. And here in the next few weeks, over basically through May, I will go back and do their sealants at Paisley, Adel, and Plush. This year there were some issues where we didn't get to reach out to as many kids as we wanted to. Our consent form is for an issue. We are redoing our consent form. Hopefully that's gonna make things better where we're able to reach more kids. Again, once we get, a couple solid years under our belt, we'll have some better data so we can see what the rates are, how we're improving all that stuff by reaching out to the kids and providing these services right there at school.
Mindy, what is your target in terms of what percentage of kids would you expect to provide sealant?
It really varies, especially coming into a new area to see how many kids have sealants, how many kids, for those of you that aren't familiar with sealants, basically it's the coating that goes on the chewing surface of the tooth, basically on permanent molars to help fill in the grooves, helps prevent cavities. So some kids don't need them, the grooves in their teeth aren't deep enough. Some kids, depending on their age, they may not have molars yet, kindergarten, first grade. Other kids up into 7th, 8th grade, they may have all 4 molars that we're looking at working on. So honestly, to throw out a number, I wouldn't even know where to begin as far as what percentage we'd be hoping for or expecting to see. It just really varies.
So would you say 10% would be a good target, 20%?
I'd say the more the better, but honestly, for a percentage again, because you can't tell which kids are going to improve and not and whatnot, so I don't have a good answer for that.
Well, if you're asking what the EOCCO's target is, our target for dental sealant molars on children is 7.9%, and right now Lake is at 12.9.
Of what you want to provide.
So that's how many have already been documented that have it. So we've met that measure here for this county, but again, the bar is rising as we go. So.
Right.
But just in terms of pure surveillance, we don't have another method that's in place to compare with what really got people moving on oral health for children, which was the SMILE survey that was conducted back in 2011 and published in 2012. So if you'll take a look at your little device here and just press and hold down any number and it'll turn it on. If during the presentation it kind of shuts off, that's how you fire it back up again. Does everybody have a live screen? Does everybody, when looking at the upper left-hand corner of the screen, see the number 42?
Yes.
No. What do you got? Here, I got
nothing.
Here, switch mine. This will work for you.
I didn't hold my mouth right when I was saying that.
No, you just turn it on. And again, if it turns off during the presentation, just fire it back up. If I asked you to prioritize something on the screen or answer a question, until I close the poll, and I'll say I'm getting ready to close the poll, you change your answer. Whatever your last answer was is the one that's up there. Okay? Make sense? Also, if you look very closely, there's no mute button on there to shut me up or a fast forward button. So no matter how hard you look, this is the way it's going to go. So let's start her off. Just reminding ourselves why we're here. This is a mixture of organizations here. It's the Lake Community Health Improvement Partnership and also serves as the Lake Community Advisory Council to the EOC, Eastern Oregon Coordinated Care Organization, which focuses on the Medicaid population. For this section of the activities, that's what we're focused on. There's also the CHIP, and then there's also the assessment that the hospital must do to maintain its nonprofit status. So we'll talk about that in a little bit. But our vision for doing this health reform is a better healthcare system, better health outcomes, and cost savings. And that cost savings is really a misnomer. All we're trying to do is curb the escalation of the costs. If you remember when we did the primer back last summer, the state of Oregon essentially agreed with the federal government that we would keep Medicaid costs growing at about 2.5%, where the rest of the country is growing it at about 6%. And if you keep going at 6%, that starts, if you make $100 grand and you get 6% raise, right? You get $6,000. Then you're making $106,000. You get 6% raise. It starts going up. So that's really what's going on in terms of that. So let's talk about the Lake Community Advisory Council. Do you think that we're impacting the triple aim? So you're just going to pick one of those answers on the chart, type it in. I'm going to be able to see how many responses are up here coming in. You got it. Your plan? Okay, 2, 4, 6, 8, 10, 12, 14, 16. We should have 16. So we got 9 up. Anybody having trouble understanding what they're supposed to do? So if you believe it's, do you agree with this statement, you would push the letter A, or B, or C, or D?
So we have 3 people that their machine is not working.
Mine says find channels.
Oh, did you change channels?
I don't
How about using that?
I'll do
And 2 more people that are.
Okay. Well, maybe we'll do this next question. I'm going to close this poll. So our results are this. We somewhat agree and mostly agree. There's some 1 or 2 people that disagree. What I'm going to do is when I'm done with this presentation, I can save this. We'll get it back to you. And some of these questions that I'm asking early on about your group, you can have more of a discussion on to see what might need to be fixed or moved forward. So here's another one. Hopefully we'll get 16 responses here. The overall state, so like the state of the union, the state of that phone, the overall state of the Lake Community Advisory Council is stronger than last year, about the same as last year, or worse than last year? Sorry, Charlie.
That's okay. It's dark, it's like.
You got 7 responses in. You guys all right?
What if I feel completely qualified to answer?
Like you don't know? Just don't then.
Okay, then.
You weren't here the year before?
Yeah.
You were up around 12. I'm going to close this poll. Sorry again.
So it says that we have 4 people whose system is not working.
I didn't answer because I wasn't here last year.
Yeah, I didn't either. I abstained.
So there was 3 that abstained. So we're about the same moving forward. Remember what we're trying to do with the coordinated care organization. Prior, we had people getting paid for going into their doctor's physical health. They were getting an assessment, treatment plan, protocol. Let's say this person gets a diagnosis of diabetes at the physical clinic. About half of people with diabetes also have depression. Once you get that diagnosis with a chronic illness, about half people follow up. So they get sent, hey, go to mental health. Mental health does a similar workup, tries to work with them on their depression. Things don't seem to be working, so they start drinking to treat both the physical and the mental issues that aren't going away. So all of a sudden they get sent to addictions treatment and they go through a similar process. And it's all separate, it's in the elevator. And then lastly, this person, after they were drinking, they fell down and broke a tooth, and then they had to go get oral health care, which was separate still. But what we're trying to do with the coordinated care organization is to bring all of that together, to make sure that all of those records and systems are sharing information so that when you go to one of those providers, the rest of those folks are going to be able to at least know that you already had this test, you already, you know, we're not duplicating screenings and those kinds of things to make sure that people are there. So we have local control. In our case, it's the 12 counties east of the Cascades. Ken is the board member of the EOCCO representing Lake County. That coordination that I spoke of between the various entities. We have our incentive metrics performances, which is really where the money flows to the local community advisory council. We have a global budget and shared savings, which means Ken and the board of the EOCCO get a set amount of money. and it says, take care of these people for this amount of money, no more, you don't get any more. It's not based on utilization, it's based on you're being able to manage things within that budget and having some flexibility. The core really is patient-centered primary care homes. The hospital and its primary care systems are working hard on becoming designated patient-centered primary care homes, because a lot of what we talk to you guys about, you know, you really can't do on your own. You need a clinician and a clinic to help make those things happen. But there are lots of things that MIRA's identified through several projects that can support that in a community setting. For instance, CC and Diane were just at a focus group on colorectal cancer screening. And part of the solutions that they talked about at the end were really trying to make it the norm that everybody gets a cancer screen for colon. You know, that it's just part of the collective part of being a Lake County resident. And in fact, they might even have suggested that there would be a, you know, like the United Way thermometer that says, here's how many screens, and really kind of make it all collective. That's community response to something that your doctor's going to be talking to you about as well. That's just an idea. I'm not saying we're doing it. And then you guys, community advisory councils, people who are local, who help us discern the difference between why those infants may be low birth weight in Wheeler County. Oh no, I don't know what other county. Wheeler was the food desert, and I know why it's a food desert. I don't know how you guys are a food desert when you got a Safeway, but I'll let those data people do that. So,
Are you biased?
well, I do know that, you know, it's access to fresh fruits and vegetables, and it's miles from a store that has a certain thing. So, I mean, you do have that benefit here with Safeway. But you also have populations out in Wagon Tire and Paisley and that are long way. So
Right,
collectively, maybe Lake County is worse off. But I didn't collectively make that data. But anyway, last summer we had a primer, which was, you just got a 2-minute version of what we spent about 45 minutes on explaining how this system works. And I don't know if you remember it or not, but it was called the EOCCL primer. And I'm curious, the polls are open. You may need to touch your screen again to make sure it fires up. But it was very much needed to help us understand the big picture. It was good, but we need a refresher, or it totally overwhelmed us and caused confusion.
I wasn't there.
Okay.
I wasn't on it.
I would have to abstain, I wasn't there either.
But you should know.
Come
on, Ken.
It should be, yeah, clear.
Okay, I'll vote.
All right, so we had some that didn't participate, but we'll go this way. Yeah, very good. We need a refresher. Actually, this has been consistent that we probably need to keep coming back and reminding folks, especially as the mix in the LCACs changes, what we're actually supposed to be trying to do. So our evolution from 2013 to 2016, we formed the LCACs back in 2013. We had our first regional advisory council meeting. Charlie is chair, and Ken also participated in that. A county commissioner or their designee or county court member and the chair of the local CACs get together quarterly. So that's the regional CAC meeting. We started allocating $4,600 in support of local CACs. We had assessments, open competitions for $1.6 million in grants. There were 2 or 3 here. Hospital got one, mental health got one.
And Dr.
Oh yes, and the Warren Medical Clinic got one to help start on the way to becoming a patient-centered primary care home. In 2015, we had the first annual report to the EOCCO board from the Regional Community Advisory Council, where they asked for more money. Chris Labhart out of Grant County was pretty adamant in our report. You know, we got to get more funds flowing, and that's where you saw this jump. Your first time you had it, you got $3,100, and now this time around, I think you guys were around 25 or 8,000, something like that, as part of the withhold to improve incentive measures. And then this year, we just had $750,000 awarded in transformation grants. And
did we got about 60,000, I think?
That would be including the LCAP incentive fund, so 47
So
transformation.
another $47,000 to do the kids one, right?
Yeah, there's 3 programs.
Right, within that one grade. So
Correct.
just remind people what they were. It's the women navigate, or, go ahead.
Okay, so for this, the incentive funds, we have the Women's Health Ambassador Program, which we just trained them last weekend. And then we have the Go Girls Program, which is an empowerment and health program for adolescent girls. And then in September, we're starting for boys and girls, a youth health advocate program. So there will be peer-to-peer health education in the high schools.
Great, thank you, Mayor. And then this year, we have LCAC and RCAC updates of their community health improvement plans, which you guys have had and need to be submitted to the state by January 30th. Here's what I was talking about, why we kind of moved this together. All of our nonprofit hospitals in Eastern Oregon are required to do a community health assessment to maintain their nonprofit status. Public health departments who want to be accredited have to do a community health assessment every 3 years. And we're required by the state to do one. I mean, we're all doing the same kind of look at stuff, so why don't we coordinate it together? Let Mira and Charlie's group have data that we're not too concerned about, but they would be as a hospital. Let public health, and then have us do our own. So this, again, when we're talking about today, we're talking about the local community advisory council and its plan. The Lake LCAC has clear goals on what the group hopes to accomplish. Everybody should be able to answer this one. True or false? One more. Yep, I'm going to close this poll. Move forward. True, good. We wanted to see that answer. Here were our 2013 priority areas for the Lake Community Health Improvement Partnership and the activities there. We had oral health and the school-based programs that Advantage took a big lead in terms of making things happen. There were resources that were acquired from the Oral Health Coalition, the Oregon Oral Health Coalition. We also have screening taking place, which was to be in lieu of that Oregon Smile Survey, so that hopefully we have some local data on how things are going. We had mental health as a priority and asked about promoting a program called Mental Health First Aid, which is a day-long training. Ben Paz's group, Lake Mental Health, got that award, and a bunch of people were trained up on it. Anybody go through mental health training? Pretty good program, isn't it? It helps people recognize and get people to the help that they need. We recently got some money from the Oregon Health Authority to implement the regional plan, and we picked this to do it. And what we're using the money for is to, if we can't get teachers who are on an in-service day to go through it, then we'll pay for substitutes so that they can have a class that goes through it. And if we can't get law enforcement off the street because they need to be out patrolling, we'll pay a substitute patrol person so that they can get the training. So that'll be offered up. We'll know that soon. Then there were a bunch of things on physical activities. We had programs and scholarships, the rec district. I mean, a lot of things happened in that area. It was really focused initially around obesity, was identified as the problem, but when we got to physical health, and then the senior services were identified. Again, you look at the demographics that Mira shared with you, I mean, it's hard to ignore that that's something that needs to happen in the community. We were looking for seniors to use more of the services that were available to them, and we also provided for the creation of a senior navigator. And if you remember last meeting, Mira was able to provide an update on where we were with these projects, so hopefully you can remember some of those things. Here's what I saw in the data from your first area, and here's what I keep seeing for 2016 that I'm going to ask you guys to look at. And that is physical activity, again, with obesity, senior services, the incentive measures as part of the program, mental health, social determinants of health. Social determinants of health deal with housing, food insecurity, education, poverty, any litany of issues that conspire to not help us be as healthy as we can be. Early childhood screening and immunizations, oral health, still health disparities, and cancer as a disease entity. And you saw the data that Mira provided earlier. So we started to talk about this data a little bit last time, but we were going so fast that I'm going to do it real quick. So I looked at the data set that you got, and remember, it was going to look like this. Mira sent it out. It had the 2016 data in it. And I went back to look at the data that we had collected for 2013, and here's what happened. You know, in that time period, Lake County gained 70 people. They lost kids, 50 of them, and gained 145 over the age of 65. So really what that tells you is that middle group got squeezed. So we got older faster, even in 2 years. You also saw a rise in the percentage of the people who are Hispanic from 6.4 to 8.3%, which leads us to needing to think about cultural competency as we're delivering services to a population of that side. In social determinants of health, there's still only a small number of people who aren't speaking English. Family size remained about stable. Unemployment declined to 9.8%, but as Mira said, we're still way higher than the state. And I think the state I think we're like at 5%, which the unemployment people say, woohoo, if you want a job, you can get one. But, you know, there really isn't unemployment anymore. And again, we still have 1 in 5 people living in poverty in Lake County. We did improve on educational attainment. Again, this is at Oregon with 6.6% without a high school diploma. You're almost double that, but you did do better. I think, personally, I think that's a function of age. I think there were a number of people in the era of World War II who did not finish high school. At that time, they went to work, and you know, this drop in the percentage of people who don't have a high school diploma is going down, not because we're doing better at education, because in Oregon right now, we're still at about a third of the kids that start in 9th grade don't finish school.
So you're saying that 11.8% don't finish? Is that what that means?
I'm saying that of all the people that are 18 and over in Lake County for the American Community Survey, which is the census, the inner census, 11.8% of them don't have a high school diploma.
Oh.
Right. But I think it's just, that makes it sound like we're doing better in education, and we really aren't. I think it's a function of losing a large population as they die who did not have a high school diploma, because it just wasn't as, you could do jobs and earn a living without that back in that era.
The other thing is that I don't know how it would affect these statistics, but I know just a few people in a county this size do affect the statistics. And now we have that 5th-year program. And technically, those kids aren't graduating until they finish that first year at community college, which is part of that 5th-year program.
Yeah, it's a high school diploma or a GED, and that's, so you're right. But I mean, that's only a few. But you're still doing, you know, we're trending the right way.
Well, and I mean, I know Lake County has the best numbers in the state as far as graduation rate. So, I mean, I think what you're assessing as far as there may be a group skewing the numbers from, you know, that are much older from a different generation. Because I mean, I know that we've gotten, you know, lauded by the state on multiple occasions of having the lowest dropout rate in the state here. So, I mean, I think we're probably doing pretty well.
Yeah, when I said we, I meant collectively in Oregon.
Indeed.
Not just right here. And I know you guys do well. You have the scholarship fund to help people out.
Right.
Anyway, in your packet, there's some data on Lake County specific around poverty, food services, those kinds of things in terms of school lunches. The percentage of renters increased in Lake, and there's a piece of data in your set called A Place to Call Home, which is about specific to Lake County. And we know home ownership and health are directly related. And we also know that communities are healthier, not in health, but just as a community as a whole. The more people who own their homes, the more committed they are to working on problems to make it go away. It's easy if you're renting to say, this place is a mess, I'm leaving. And that's what people do. We vote with our feet and move places. 1 in 5 American families changes their address every year. 1 in 5 American families changes their address every year. Percentage without personal transportation, you saw a little increase, actually 1 full percentage, which would be 20% within a 20% change there. And we saw a decrease in those without phones. At one of the meetings, Charlie asked about our non-emergency transportation, and we were able to bring data back on how many rides there were around the region. And Lake actually was using services right about at the norm, but we wanted to promote more. And last week there was also, or last meeting there was also a sheet on non-emergency transportation. So again, these are things that have to do with social determinants of health. In Lake, according to this sheet, you need about $21,000 to be able to rent a 1-bedroom apartment at the fair market value. So this is not what a 1-bedroom costs. It's as a percentage of your income, you shouldn't be spending more than X on housing.
Yeah.
Just like if you went to get a loan and you said, oh, I could pay this, and they go, well, how are you gonna eat? You get a car, you gotta pay? No, we wanted around 30%, somewhere in there, but that's all you should be paying on housing. And if you notice what average annual income is for people who are on Social Security, veterans, pensions, or disability, it's gonna be hard to keep up on that 1-bedroom apartment. For a 2-bedroom, you need about $25,480, and these are some of the salaries from the survey that they took from Lake County. Just be
Well,
aware.
I do not understand that, because if you were paying $1,000 a month for a place to live, it'd be $12,000 a year. I don't know, if you look through the paper, you can, there's no place for rent for $1,000 a month. They're all less.
They're all less.
Oh, yeah.
Yeah, well, where is it saying $1,000 a month?
Well, you're saying income needed, you need to, are you saying that includes, so that factors in what you need to pay for rent plus what you need to live?
Yeah.
Okay, so.
Yeah, it's as a percentage of.
Okay, that's not what you're
so-
paying for rent.
Right, no, not.
So if you take $21,000 and take 30% of that, so that's roughly $6,500.
Yeah,
Divide that by 12, and you'll get about what the rent would be.
$550, something
Yeah,
like that.
okay.
$550. So what it's saying is a $21,400 or $500 is enough income, because 30% of your income should go to pay for housing. But that's housing plus heat.
Okay.
Plus food, plus car, plus going to the haircut place, Joe.
I don't need that.
Some people are blessed with not having that requirement.
Health data. Since 2013 and now, disability was split into 2 groups. It used to just be everybody who had a disability. Now it's less than 18 and 18 to 64. So next time we look, we'll be able to see where the disparity is. In our behavioral risk factor surveillance system, that's the survey that the state does, the percentage of people who reported good, very good, or excellent health. And they just said, how's your health? Pick one of these, and they give you a litany of about 8 or things. Lake saw a decrease down to 89, and Oregon dropped as well during the time period from 08 to 11. So like when Mira said, they take a look at the births so that there's not a couple of low birth weight babies. It makes it look like every baby born in Lakeview or Lake County was low birth weight. You do it over 5-year averages so that it kind of weighs it out. In behavioral risk factors surveillance on smoking, Lake saw a decrease all the way down to 13.4. That's good. And Oregon saw an increase in smoking overall. And Burfus smokeless tobacco, Lake was at 13.2% in 08 and 11. And if you remember, they only asked males that. And what I'm hearing is there's a lot of women cheaters out here.
Yeah.
Oh, is that?
Yeah. Oh, is that?
But I don't think the people in Atlanta believe it. They're the ones who make up the questions. Obesity, we saw a huge increase from 19% over this 06, 09. So there's an overlap period.
Isn't that kind of a ton?
A huge increase. I didn't mean it that way. I just meant that the numbers real big. To 34.1%. You know, there's some overlap there in those years, and Oregon is at 35.9. So our efforts around physical activity are so important. Heart disease deaths dropped, stroke dropped as well, but you're still in both of those categories above Oregon. Again, I'm going to give you this presentation back with the results of our votes. Suicides increased in Oregon, and you guys remained about the same, which is almost double that. The mental health piece is a bit concerning as well. We have Oregon decreasing. So I just think this is interesting. Same people, they said, how's your overall health? And they're rating themselves, you know, good, very good, or excellent, thinking that you're just talking about your physical health. And then when they asked specifically about mental health, and just the reporting on the good, it decreased. So it was like 20% less. I mean, people are saying they're less mentally healthy, but overall they don't make that connection overall. So Lake dropped slightly. And DUI rates dropped significantly in both areas. And those are people who are arrested in Lake County, not Lake County residents. That's where it happens, not there.
Is that the same thing with suicide?
No, if somebody came out here, the death would go back to their home county. The other thing that you should know there is if anybody used physician-assisted death with dignity, that is not labeled as suicide. It's part of separate death. Health disparities data, this behavioral risk factor surveillance system, the state did a survey only just with Medicaid people. So what you saw in the earlier reports was everybody in Lake County was eligible for the survey. This survey, they just said just Medicaid people, and it didn't matter what the question was. Their rate was lower or worse than the state. So, you know, whether it was how healthy do you feel, have you been screened, have anybody told you you had diabetes or heart disease? In those cases, the answers were yes. It was the opposite of what it was. So for the LCAC, what you'll see on the priorities is basically health disparities as an opportunity to prioritize. The last thing there, know that all the data that we have for our plan members, 1,800 and something, I think, in Lake County, somewhere in there, we can collect all that by race and ethnicity and report that out, as long as it doesn't get too small, like at a zip code level, where you might be able to make it go. Back to your tools, fire it up. Make sure that you aren't pushing people responding because if they pushed A or B to turn it on, you voted. So
We can change it though, right?
Go ahead, you can change it now. I have a good understanding of incentive measures and how the local community advisory council funding is tied to these. Got 15 respondents, so I'm going to say that's a closed poll. False. Okay, then we're going to need to work on this. We did have one meeting where it was either Sean Jessup here, I think, came in over the phone, kind of talked about things, but yeah, we did. Every county had one. Was it Jordan Ann? One of them did, or Susanna. Okay, I know that we had, because I was here for it. This is important. We got to make this 100%, understanding how this works. Because the key is that the state withhold money from the EOCCO. So Ken, as a board member, this year, they withheld $10.6 million from our budget and said, you need to meet these incentive measures. If you do meet 13 of 17 of them, you get that $10.6 million back. When the EOCCO board gets that $10.6 million back, they invest in patient-centered primary care homes. They invest in data. They invest in the local community advisory councils. They do the transformation grant dollars out of that stuff. Every year, even though we're improving, they keep raising the bar and withholding more money. So in 2013, when you got $3,125, I think only $2 million was withheld. 2 years later, it's 10.6. Next year, it's going to be even way more. So if we're not meeting these measures, we're losing money. And in fact, if we as an EOCCO don't make it, it's about $750,000 to $800,000 per measure is what's lost to Eastern Oregon. And it goes to other places if that's not the case. Yes?
Does that mean that we'd also be rewarded more money
Well,
as time progresses?
distributing that, I'm gonna let Charlie talk about that and Ken as board members. There's discussion that says, why are we giving money equally when certain counties are performing well and others aren't? But right now, if you're giving money to primary care to improve, it's based on, how many patients they have assigned to them and not whether or not they're helping meet the incentive measures or not. The money for the LCACs is based on how many plan members you have. If the pie gets bigger, then you're going to get more money. But your question was, if we're doing better, do we get rewarded? And the answer is right now, no, but there's a lot of people that want to reward better performance. So I'll let you comment on that, Charlie, as well. Because that's a great question. And it doesn't bode well right now when you look at lake data for you guys.
So there's a couple things to keep in mind. In Eastern Oregon, so this whole swath of area except for the greater Bend area, there's about 55,000 people that are in the Medicaid program or in Eastern Oregon CCD. We represent about 3%. So if we do really well or do really bad, 3% is a really small number. So right now, we are benefiting because all the small counties like us are treated pretty fairly. But the big counties are going to say, if the small counties aren't carrying their weight, the money ought to go where the population is. So right now, it's more fair for us because we're so small. But we don't want to let anybody think that we're not carrying our weight. And remember, if we can impact 50 people, and we only have 1,700 to do it, 50 people is a lot of people that are in Lake County. Every one of them, we got a bunch here. So remember, our incentive is not based on somebody else taking things from us, or could we get much more reward? Because at 3%, we're never going to get a big reward. We want to be able to prove that, number one, it's good for every single Lake County resident. And number two, we're doing all that we can to prove that Lake County is as committed to good health as any other place, whether a big population or small population.
And I very articulate there, Charlie. And I think really what I think the board will do is they'll keep a base and then they'll have a performance measure. So everybody will still get it. It's not like they're going to take it away, but they would definitely reward once a base is established. How that's going to work, I can't tell you. Here in your report, you have what was closely the latest data. Remembering that colorectal cancer screening is done by an audit in charts of physician offices. But for the following need improvement, and remember, even if we're improving next year, the percentage of what our target is keeps raising. And it hurts to try to get over that bar. So screening, brief intervention and referral to treatment, that's a drug and alcohol question. You guys are at 1.5% of the people who have been screened. The target is 7.9. Effective contraceptive use for women of childbearing age. Thank you. When I first entered the field, they were called fertile females. It's bad.
Look out.
That's what it was. That was written in books, you know. You're about 2/3 of the way there. Timeliness of prenatal care. This one can still change based on some efforts, but you're at 75%, the target is 90%. When Mira talks about low birth weight infants, there's a direct correlation between adequate prenatal care. And that means you started care in your first trimester, and then you had the required number of visits until the delivery. So, yes.
I wanted to address a question that Beth actually had last meeting, which was about the fact that there has been some patients that come in and say that they haven't been able to see a doctor until 12 weeks after when they're pregnant, which would make us miss that mark.
Right, because they weren't in the first trimester. I don't know what the answer was to that.
Well, yeah, so I actually went and I went down to the clinics and I talked to them. And they said indeed, they have really tight packed schedules, so often they are scheduled out a few weeks after. So if a woman finds out she's pregnant, she's already 6 weeks. If she's scheduled out a few weeks after, that might be why we're missing that mark. However, we recently got on board an OBGYN who's going to be here 1 week per month. So I think we're going to see some improvements in our numbers.
That would sure help. I know that Grand Run Hospital in Grand found that was their biggest thing too. It was the people who were making the phone appointments were setting it up as if I called and said I need a sports physical or something. And once they prioritized and said we're getting women who think they're pregnant in right away, their rates just went right up. So somehow prioritizing makes a difference. Colon cancer screening, developmental screens for kids less than 36 months at 16%. The target is 37%. Adolescent well care visits 13%. Target's 27%. And you met the utilization of the ER, so people aren't going to the ER at the same rate. And EOCCO will not meet this measure. We had an increase in people going to the ER, and we also did dental sealants as well. I think a big attribute for Advantage, who carries most of the people here. And again, in your packet, you'll see a sheet that has the percentages for all the counties. This is a working document. Every time there's claims, these things change. So that's a static point back in December. Healthcare utilization. I also sent, I saw somebody with it here, back a while, you guys had requested that the data sets be separated for North and South Lake County, so that's how they're run here. And so I have both North and South Lake. I looked at that healthcare utilization report. There's a lot of data in them that I'm not highlighting here, but it is important. So we looked at all of 2014 and all of 2015 for the South Lake area. Is anybody here from North Lake yet? Anybody come down from Christmas Valley or anything? We got nobody on the phone, so I'm going to skip the next slide. I'll focus just on this one. You can see a jump in total members. You can also see that the jump was due to the Affordable Care Act and the Medicaid expansion program. We went in 1 year from 278 to 487 and gained about 300 folks during that time period. About a quarter of them, or a little more than a quarter of them, are kids less than 18. Total claims paid to provide for people from this county. So if they went to K Falls, they went somewhere else, and we paid a claim for their utilization was about 2.7 million. In 2015, it was up to 3.9 million. So if you think about trying to, keep it at that 2.5% growth, we're over, but we also have a lot more people, so we're going to have more claims. So the real way to look at the measure is down here at spending per member per month. In 2017, it was 276. Here it's 292. And you can see for all of the EOCCO it was 285. So there's not like any big discrepancy in what the expenditures are for the people here in this county. People were always concerned when we shared this data about this number right here. 27.9% in 2014 that had a Medicaid OHP card never used any services at all. None. It went down slightly. When we think about how many of them are kids, and we think about that developmental screen, we think about adolescent well visits, we think about all of those incentive measure activities, which if you really look at it, they're about prevention and screening. They're not about treating disease, they're about identifying. If we can't get them in, then we're not gonna be able to help them. So we definitely want people to use their services. You add in another 32% or 30% who spent less than $500 in claims. That now we're up around 58 to 59% of all the people who have spent less than $500 over the claim limit, right? You can move down as a percentage until we get to the bigger ones, and you can see in 2015, 3.2% of those 1,125 people in South Lake County, not the whole county, consumed 57.5% of all the expenditures. This is where our board of directors, the EOCCO, and primary care really need to work with an integrated service with mental health delivery services, because these people have complex needs and need services to wrap around them to save. Because if we can save portions of that money, that's where we'll save money to actually pump into prevention. And then you can see down low by types of service as a percentage. Again, this chart and North Lakes is in your packet.
Well, I don't suppose you can find out like what the ages are of the different utilizing services. Like,
you know what? In the report, there is a breakdown. You can't tell too much. You just can't get to. Did you get the report?
Yeah.
Okay, there is one little grid that says percentage of dollars spent by age. Looks like this. And again, there's a lot more in here than you think. So overall, inpatient costs are rising for the EOCCO. We have less people using primary care, and that's the direct opposite of what we want. We want more primary care, less hospitals. And prescription drug costs are rising like crazy. And we've been doing some good things on there, but most of them are called specialty drugs. Like if someone was being cured of hepatitis C, that regimen is about $150,000 a year. So one person, lots of that. In the back of your report, there is a list of specialty drugs. So I'm looking at South Lake, and we had 5 people who spent $246,000 on drugs. There's nothing we can do about that. That's just what the drugs cost. And their specialty. The prenatal and maternal, there's data in there for the early learning hubs, which have an overlap of 2 incentives, the developmental screens and how many kids are assigned to a patient-centered primary care home. So the data is in your packet, and here's the specifics of it. For all of Lake County, we had 33 people who were Medicaid between the ages of 0 and 36. Remember, the early learning hubs care about all kids less than 36 months, or all kids between 0 and 6. This data is the only stuff we have for our plan members, right? Make sure that makes sense. So if they were white, 19.5% of them were screened. If they were non-white, 50% of them were screened. And the total members aged 0 to 6, we had 282 assigned to a patient-centered primary care home. If they were white, it was 10.6. If they were non-white, it was 14.7. So not much really in terms of health disparities. Summary of changes, fully immunized. We had a decrease in Oregon, but we had an increase in Lake County, which is good. We want kids fully immunized by age 3. Births to mothers younger than 18. That was changed from a rate to a percentage, so we couldn't compare the time period from prior to this year. Inadequate prenatal care weight. Mira talked about child abuse in Oregon decreased, and it did in Lake, which is still much higher than Oregon in terms of abuse or maltreatment. And
is that because of better reporting or worse reporting?
Well, Charlie, that's a great point. If it doesn't get reported and sent to investigation, it doesn't count.
So for those counties that don't do good reporting,
Yeah, if you know, exactly.
and those that do a better job of reporting, they look worse.
Yes. How many people are mandatory reporters and know what I'm saying? Okay. Let's go to the Safeway and see if we really follow through. Okay, so the data sources are there, and we're right at the end here. Recap, here's the themes I saw for 2016 on the right-hand side. And if you would, before I move to the next slide, make sure your tools are up, because we're going to prioritize now, and this requires a slight change. It's going to recognize that I'm asking you to put things in order, okay? You're going to push a letter, and then you'll see a comma. And then you push another letter, you see the commas after that. And then there's going to be a button that comes up that says OK. And then once you feel like you got your number of responses, you'll hit that. It'll clearly show you what to put to send. So let's do this and wrap it up. Choose your top 4 priority areas for potential for inclusion in the Lake Community Health Improvement Plan for the LCAC. When you push these buttons, they're going to be weighted. If you say the first and most important one that we should address is something in social determinants of health, you're given that a weight of 10. Your second one's going to be 8, your third one's going to be 6, and your fourth one's going to be 4. So it'll differentiate the responses. So pick your top 4, hit enter, and we'll watch the responses, and we certainly want as much participation here as we can.
Well, what's that, health disparities?
The health disparities was for the Medicaid population, when all of their behavioral risk factor surveillance system was worse, and or if you're looking at other data by race and ethnicity, although in the early childhood stuff, the non-whites were doing better as a percentage than the whites, but generally we're talking about just focusing in on the Medicaid population. Is everybody seeing how you're...
You said top 4, right?
Top 4 only. It should only let you do 4.
And then we hit OK.
There was a little...
Yeah, I see it. I just want to make sure that's
Yes,
okay,
then
got
it's
it.
in.
Okay, and then.
Work for you? See at least one more. Everybody thinks they voted? Okay. I'm going to close the poll. Anybody want to guess? Let's guess real quick. Top 2. Ken?
Early childhood and physical activity.
Physical activity senior services.
Physical activity senior, how about it?
Senior services
Oh, go ahead, Donna, you go.
and cancer.
In cancer? Okay, how about you?
I had,
Oh, what you had, what do you think everybody's gonna pick?
Health disparities, physical activities, and then cancer.
Okay. Mira, in the know, what are you guessing?
I'm thinking senior services and maybe physical activity.
All right,
Or oral health.
let's see what happens. Physical activity and senior services, and that would be the 4th one, mental health and early childhood. So those are the 4 areas. How is that different than what we picked in 2013?
Pretty close.
They're pretty close.
It's close, except oral health significantly dropped.
Well, we've had a lot of progress there, but we also can continue to maintain that function if you want to keep it in the plan, because there's still resources. You gotta remember, stuff you want to put in the plan is stuff that you can get money for, right?
Yeah.
So that's an important piece of it. So what I'm going to do, that's it for me. What I'm going to do is I'll save this presentation so you get the results. It'll be in a PDF, so all the slides will be there and the answers to the ones that you just had. The results of this will be available to you as well for that. Any questions? So what we're looking for again is an update on the plan. And then at the end of June, the state of Oregon requires an annual report from the LCAC, and some of those questions that we asked earlier about how we're doing, where we're going, can be used to formulate a response. It's not too rigorous. You saw that at the,
Right, yeah.
which is kind of a list. But yes, we're meeting, we have real people, they show up, so. Any questions? Comments, Ken, as a board member, in terms of, you know, how things are going?
Not so much on her, but on the determinants, I'm still a big proponent of, we meet and we have some programs in Dentro, but we need some venue to get it out to Joe Blow and Josephine out in the public. I've been wanting to just write little things for Dentro or whatever, just to get it out there in the newspaper or radio or anything, because it's the citizens that we're really trying to touch. And we just need to continue improving on our communication with our average citizens.
So Ken, you're meaning to say that to communicate how we are, kind of like a summary of this data?
No,
Okay.
not of the data, but communicate the benefits or the detriments of such a K, such a B. You know, just periodically something out there so it resonate with both radio and newspapers. No, not everybody reads newspapers, but somehow getting it beyond this group to the citizens.
Yeah.
Continuously promoting in whatever venue that we can. We can hold public health day here, but, you know, or something, but we need to reach farther and farther and farther out into the population.
I agree, Ken. We've talked about this at this meeting before. I went back and talked with some folks. I think, you know, as a board member, you know, there's a couple of people I can point you with. There's a coalition of people who would agree. We have not done a very good job of promoting what we do at EOCCO at all. I mean, even a lot of the good work that's happened through the 2-point-something million in transformation grants, the work that's happening here, there's nobody who's dedicated to communications, you know, who can write things up. I think there should be, you know, a certain pile of money that's going for paid media, not just to try to get things out there, but to buy billboards, radio spots, that everybody would hear. Is your child between 0 and 36 months? Ask your doctor why they haven't gotten a developmental screen. Boom. That's all you need. And then whether it affects a Medicaid recipient or any other mother, or, you know, dental sealants prevent a lifetime of life. You know, I mean, small messages. So, you know, once we learn what our withhold gets back here, if we get all of it, you know, say, let's set aside a certain percentage of the money and do paid media and pay somebody to do it. Maybe like the Eastern Oregon Healthy Living Alliance.
Yes.
You know, that would be a good vehicle where they can coordinate and make sure that the message is the same. You know, and it would be in Hispanic and out here and Umatilla or whatever. But we just don't do it.
Education and communication, or communication and education. I don't care what's come first.
Both of them.
But you have to get it out there to the recipients.
Yep. Yeah. So
Well, another thing that's so important really to look at is that social determinants of health is huge. Because you said it, Paul, in your data that you have, every single health outcome is worse in people of lower income. Every single health outcome is worse. So the more we can improve people's social status, their socioeconomic status, we're just naturally some of that stuff's going to go away. They're just going to improve health. I mean, you just see it over and over. So it's just something really important that's a hard one for people to think about focusing on. But as a community, we need to really keep thinking about that. And that's hard. Economic times are tough, but we need to think about that because it's only going to get worse.
That's
We don't
what-
work on our
housing, food, education,
Yes,
poverty.
the
I mean, those are hard things to do. But, you know, there are things that can be done in those areas.
I wanted to respond to Ken also, that not only media, but also getting people educated and empowered. That's a lot of what we use the transformation funds for, educating our youth and getting them to understand, you know, the the consequences and the benefits of healthy behavior, as well as women. And, you know, it's not just because I'm a woman that I had an interest in that, it's because they're the mothers, they're the wives, and, you know, like, there's a saying that says, sometimes the man may be the head of the household, but the woman could be the neck and turn the household wherever she wants it, right? And so they're powerful, and so that's why we have these women health ambassadors now who are going out into their churches or at Head Start and really dispersing this education.
Yeah. And I do appreciate, because you got some good programs there. I'm just saying, let's keep building.
Yeah. Okay, so, can I now switch gears? All right. So I wanted to kind of invite the different organizations to think about using a format, past that, of community health assessment, which is called MAP. And some of you may have heard of it. It's Mobilizing for Action Through Planning and Partnership. And you can read through the information on your own. All of this kind of gives a backdrop. But what is specifically different about MAP than other kinds of community health assessments is that it emphasizes partnership with reducing duplication. So that we're really a partnership rather than maybe supporting one entity rather than another, and funds are wasted. For an example of that is the developmental screenings where, you know, public health is doing it already, Head Start is doing it, the hospital is doing it, so where can we make those connections? So I'm inviting all of you to look over this format as what we would utilize in the next couple of months with the target of completing it in next winter. And it also is compliant for public health assessment, so you would actually be meeting your requirement. And it also meets the hospital's requirements. So it's a good partnership. It's framed, and I did speak with some folks at EOCCO. They would help guide us through that process. And it's a little bit, it's tight, you know, it's a tight way of handling it. There's phases and structure that would be good. Are there any questions on that? So then next meeting, we could officially sign on to which organizations would like to be a part of it.
Just for clarity though, this is the community plan, not the LCAT plan.
Correct.
Okay.
Yes. Yes, because, you know, of course, a lot of what we're doing is associated with the CAT, but also, you know, we're a community partnership, and it goes beyond that. It's not just the Medicaid folks, although they are often the most vulnerable. It's our entire community.
Good, well, let's think about that for the next meeting and be thinking about how we want to, it sounds, I mean, you need to digest this, but think about this as we're moving forward. But this really segues nicely into the next part that I want to talk a little bit about. And that is, what do we call ourselves? You know, we started off as a CHIP program. For those of you that don't know, or have been with us since we started, CHIP. CHIP stands for Community Health Improvement Partnership. Thank you.
Yes.
Partnership. The way we got started was we got a grant from the Office of Rural Health, partnered with the hospital, put money together. We hired John Adams, and we started on this process of looking at the health of the community. And we came up with a plan. For those of you that don't remember or weren't here, that's kind of what we did. We went through a process and picked our goals, as you saw. Then along came Affordable Care. And the Eastern Oregon CCO started up and running. But that was targeted on one portion of our population. It's about 25% of our Lake County. And that's really where most of the money has come from. Now, we got some money to help us with our dental program. And we did get money from the CCO to do things with our seniors and with some with mental health. But again, it was focused by and large on the needs and interests that specifically focus on 25% of our population. We keep bucking that when we talk about senior needs. That's really not where the money is. So when we think about that, and as Ken says, we need to be talking to people. We need to really talk more about health needs. We all know about obesity. It's happening across the planet, but especially in Lake County, especially in rural places. So yeah, we're not just targeting a certain group of people. Yes, 25% is a lot, but there's a whole lot of other people that aren't in that. And if someone says, well, it doesn't make a sense, it doesn't matter to me. I don't really care about colorectal cancer. I don't want to hear about it. We had that conversation where you were talking about talking to that to at church. Well, nobody wants to talk about colorectal cancer or colon cancer or anything like that. But yet, and that's not, even though we want to, we have CCO money to deal with that, really, it's not that population. Because the population is really much younger. So I think it's important that we think about, and I'd like you to be thinking about, what do we call ourselves? We are the CAT, Community Advisory Council. That meets the requirement of the CC. We've been a CHIP. That meant a specific need to do an assessment and develop a plan. Yes, the hospital has a requirement to do a community health assessment. Yes, WIRA is working on it. But so does public health. They have a requirement. And yes, as Paul said, we're all going to try and work together, so that's more efficient. But again, back to what do we want to call ourselves? Do we want to keep going by Community Advisory Council? Right. We want to go by a CHIP? Okay. Let's try to get to where we have one name. And so what I'd like you to be thinking about when we talk, maybe if you have suggestions, get them to Mira or bring them. But think about what else would we call ourselves. We can continue going on as Community Advisory Council, or Health Advisory Council, or Lake County Health Improvement. I don't know.
Lake County Community Health Partnership.
So, okay,
Talk about
there's a good
What did you
suggestion.
say again? Lake
County Community Health Partnership.
So one of the
Check it
things,
out.
when you think about naming, which one of you thinks of this as you personally are a community member? You think about your personal health. So it's easy to say, well, it's not me that's smoking, it's somebody else. It's not me that has diabetes, it's somebody else. So keep in mind how, well, as we think about naming, or how do we want to define ourselves? Because I think that's part of our message. And if we want to talk and be more articulate in our community, how do we define it? So we have about 10 minutes left. If anybody wants to talk about that, talk about anything else. Mira has, we talked about having too many things on the agenda before. We are a little bit ahead of our schedule.
I did get feedback from your meeting with the ambassadors. They said that it was excellent, and a couple of them were talking about how open everyone was there, that to talk, they felt comfortable and respectful of each other, and they said it was just a great training.
Thank you. Yeah, it was better than I could have ever planned it. So I'm really excited to see the outcomes.
I think we want to keep remembering that Lake County is a small county, a big county, but it's a small number of people. And we can make a huge difference on our neighbors, sometimes even ourselves, doing all this, but talking to our neighbors about it. And if we can empower them, if we can, I mean, heck, 50% of our population, if they're empowered, they can tell us that we can be the head or the neck, I don't know which one. But That's really important stuff. And I think that's, to me, that's the most exciting thing we can do.
Charlie, one thing I think maybe we all here would be interested to know, in terms of food security, that kind of thing. To me, one of the most exciting things, I just really hate waste, and especially in areas like food. And anybody that's walked by the Safeway dumpster in past years should have been appalled by the amount of food that goes in there. And they have, within the last month, started in connection with, well, Safeway / Albertson and Oregon Food Bank, which, of course, locally is Klamath Lake County Food Bank. And locally is Food Pantry. Started a program called Fresh Alliance, where not only bread, you're probably all familiar with that basket of bread that some people have abscond with, but it's meant to go to the pantry, and which also includes the senior center frequently. Anyway, they started that Fresh Alliance program where they also give out the produce that's pulled, stuff out of the cooler that's, getting close to full day, meat that's likewise, general groceries, to the point that in March we received 4,038 pounds of food from Safeway, which is astronomically more than that bread that we used to get. And that's impacting all kinds of, making a huge impact. 500, well over 500 pounds was just those loose, an apple that's got a mark on it that they pull is still good, but it's not, customers are looking for one with a bruise or a little scrape or whatever. So just in that, it's added up to close to 600 pounds of fresh fruits and vegetables. At the pantry, we used to have, during the growing season, we'd have some fruits and vegetables, especially as the food bank was able to provide them. Hardly anything locally. And now we just have a whole table just loaded with fruits and vegetables every week.
That's outstanding.
Which is amazing. And I just thought, kudos to Safeway for being willing to do that.
That might be something that our local paper and radio ought to really tell people and thank Safeway.
Yeah.
Oftentimes, not every organization gets the credit for some of the things that they do.
And that was a policy change that Safeway made, which was awesome of them. I mean, you're absolutely right. You start talking about thanks and gratitude, I totally agree, because they, for a lot of years, had a different policy. They were afraid of legal liability, they were afraid of other things, and they chose to not live in fear. They chose to say, we're going to help people regardless, and it was really cool of them. I totally agree with you, Charlie, that's awesome.
And we need to reach out that same concept to the store in Christmas Valley.
600 pounds this month, so?
Well, March is complete, of course, so that's
Right.
the only one. And I don't think we started very first of March, but anyways, 4,038 pounds of food from there.
It's still exceptional.
Probably.
And it's something that really we ought to go out of our way to thank them for that, because it does make such a big difference for those people that really are needing that.
Mike, would the food pantry do maybe an article for the newspaper, Jimmy? And talk about that, what's available, kind of tell people it's available and thank Safeway, and also maybe do that it's one of the goals of the CAC is to get people eating more fruits and vegetables, and here's a way you can do it.
And
Good tie all three.
And just put a little nick in there, the benefits of fruits and vegetables as opposed to French fries.
I'm sure that, because I was talking about the loose stuff, just the orange, tamarind, whatever. But then we have, on some days, we've gotten 35 heads of lettuce, which kind of varies in lettuce. But nonetheless, probably well over a ton of that was fresh fruits and vegetables.
Nice.
And what percentage of that actually get passed on? I mean, there have to be some that all of it?
Well, there's a little bit of waste, but we
Not much.
try to move it so fast that,
Okay.
we kid about like the strawberries, you have to use them within 25 seconds. That's
I don't know if it would be hard for you to do, but I have a hard time picturing 1,000 pounds of food. But I also can think, when I brought up 3 oranges and they said that's 3 pounds, $3.90 for 3 oranges anyway.
Yeah.
Is there a way that you can make it servings? That would make it relatable to everybody.
Yeah.
Servings of food that would, were available to somebody. Because I would know, I mean, if you said 500 pounds and I said, how big a box would that be? What happens if it's a watermelon versus raspberries? Or grapes, I mean, and so pounds, I don't know. It just, I have a hard time, I was trying to figure out like how much was there. And I do know, you said about waste. I mean, I think that the Cisco food system, I don't know whether they help you here, Charlie, or.
We buy from Cisco.
Cisco, I mean, one of their executives in the Portland area told me that it's basically 49% of all food is thrown away.
It's
Yeah.
tremendous.
And a lot of it is in institutions, so schools, hospitals, nursing homes. It's just, yeah.
Well, one of the things they give out a lot are those salads, pre-made salads, and they weigh next to nothing. So we're
Right.
talking about in terms of bulk, I mean,
Yeah.
just about everybody that goes to our pantry gets 1 or 2 salads and, all kinds
Oh,
of stuff.
that's good.
But salads that have chicken in it?
Yeah, the ones that have chicken and ham, diced ham,
Chicken.
cranberries.
You have to be careful on chicken. That's the closest I ever call 911.
Yeah, we push those first, yes, we push those first.
Sticking with that meat, eh?
Thank you. Well, do we have any other issues we want to bring up?
I would just like to thank people in Lake County who participated in our first colorectal cancer focus group just right before this meeting. We had 11 folks there, and we'll certainly be sharing the results back when we finish the other 4 shared up things. So I was grateful that everybody showed up, and we had a really good meeting. These ladies can comment, they were there.
Yes, we did.
I supported the hospital last summer by doing stuff.
Thank you very much. Thank you, everyone, for coming. Is this time of day a good time?
That's a lot better.
It's more better.
Excellent, we will continue to try to make that happen. Thank you very much, we really appreciate it.
Oh, I just wanted to tell Mike that you might check with that Fresh Food Alliance to make sure they want it advertised before you say anything, or let's say
I thought
what,
about that too.
they may not want it publicized.
I mean, in a sense, there's
Yeah, I
out with their
know,
own.
it should be, well accepted because it's not thrown away, but you never know.